Section 57 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Anna Simon. Anatomy of the Human Body, Part 4 by Henry Gray. 1D.2. The middle ear, or tympanic cavity. Cavum tympani, drum, tympanum. The middle ear, or tympanic cavity, is an irregular, laterally compressed space within the temporal bone. It is filled with air, which is conveyed to it from the nasal part of the pharynx through the auditory tube. It contains a chain of movable bones, which connect its lateral to its medial wall, and serve to convey the vibrations communicated to the tympanic membrane across the cavity to the internal ear. The tympanic cavity consists of two parts, the tympanic cavity proper, opposite the tympanic membrane, and the attic or epitympanic recess, above the level of the membrane. The latter contains the upper half of the malleus and the greater part of the incus. Including the attic, the vertical and anteroposterior diameters of the cavity are each about 15 mm. The transverse diameter measures about 6 mm above and 4 mm below. Opposite the center of the tympanic membrane it is only about 2 mm. The tympanic cavity is bounded laterally by the tympanic membrane, medially by the lateral wall of the internal ear. It communicates behind with the tympanic antrum, and through it with the mastoid air cells, and in front with the auditory tube. The tegmental wall or roof, parius tegmentalis, is formed by a thin plate of bone, the tegmen tympani, which separates the cranial and tympanic cavities. It is situated on the interior surface of the petrous portion of the temporal bone, close to its angle of junction with the squama temporalis. It is prolonged backward so as to roof in the tympanic antrum, and forward to cover in the semicanal for the tensor tympani muscle. Its lateral edge corresponds with the remains of the petrous squamous suture. The jugular wall or floor, parius jugularis, is narrow and consists of a thin plate of bone, fundus tympani, which separates the tympanic cavity from the jugular fossa. It presents, near the labyrinthic wall, a small aperture for the passage of the tympanic branch of the glossopharyngeal nerve. The membranous or lateral wall, parius membranacea, outer wall, is formed mainly by the tympanic membrane, partly by the ring of bone into which this membrane is inserted. This ring of bone is incomplete at its upper part, forming a notch of Rivenus, close to which are three small apertures, the iter chordi posterius, the petrotympanic fissure, and the iter chordi anterius. The iter chordi posterius, apertura tympanica canaliculi chordi, is situated in the angle of junction between the mastoid and membranous wall of the tympanic cavity, immediately behind the tympanic membrane, and on a level with the upper end of the manubrium of the malleus. It leads into a minute canal, which descends in front of the canal for the facial nerve, and ends in that canal near the stylomastoid foramen. Through it the chorda tympani nerve enters the tympanic cavity. The petrotympanic fissure, fissura petrotympanica, Glaserian fissure, opens just above and in front of the ring of bone into which the tympanic membrane is inserted. In this situation it is a mere slit about 2 mm in length. It lodges the anterior process and anterior ligament of the malleus, and gives passage to the anterior tympanic branch of the internal maxillary artery. The iter chordi anterius, canal of Huguier, is placed at the medial end of the petrotympanic fissure. Through it the chorda tympani nerve leaves the tympanic cavity. The tympanic membrane, membrana tympani, separates the tympanic cavity from the bottom of the external acoustic meatus. It is a thin, semi-transparent membrane, nearly oval in form, somewhat broader above than below, and directed very obliquely downward and inward, so as to form an angle of about 55 degrees with the floor of the meatus. Its longest diameter is downward and forward, and measures from 9 to 10 mm. Its shortest diameter measures from 8 to 9 mm. The greater part of its circumference is thickened and forms a fibrocartilaginous ring, which is fixed in the tympanic sulcus at the inner end of the meatus. This sulcus is deficient superiorly at the notch of Rivenus, and from the ends of this notch two bands, the anterior and posterior malleolar folds, are prolonged to the lateral process of the malleus. The small, somewhat triangular part of the membrane situated above these folds is lax and thin, and is named the pars flaccida. In it a small orifice is sometimes seen. The manubrium of the malleus is firmly attached to the medial surface of the membrane as far as its centre, which it draws toward the tympanic cavity. The lateral surface of the membrane is thus concave, and the most depressed part of this concavity is named the umbo. Structure. The tympanic membrane is composed of three strata: a lateral, cutaneous, an intermediate, fibrous, and a medial, mucous. The cutaneous stratum is derived from the integument lining the meatus. The fibrous stratum consists of two layers: a radiate stratum, the fibers of which diverge from the manubrium of the malleus, and a circular stratum, the fibers of which are plentiful around the circumference, but sparse and scattered near the centre of the membrane. Branched or dendritic fibers, as pointed out by Gruber, are also present, especially in the posterior half of the membrane. Vessels and nerves. The arteries of the tympanic membrane are derived from the deep auricular branch of the internal maxillary, which ramifies beneath the cutaneous stratum, and from the stylomastoid branch of the posterior auricula and tympanic branch of the internal maxillary, which are distributed on the mucous surface. The superficial veins open into the external jugular; those on the deep surface drain partly into the transverse sinus and veins of the dura mater, and partly into a plexus on the auditory tube. The membrane receives its chief nerve supply from the auriculo-temporal branch of the mandibular. The auricular branch of the vagus and the tympanic branch of the glossopharyngeal also supply it. The labyrinthic or medial wall, Paris labyrinthica, inner wall, is vertical in direction, and presents for examination the Finestra Vestibuli and cochleae, the promontory, and the prominence of the facial canal. The Finestra Vestibuli, Finestra ovalis, is a reniform opening leading from the tympanic cavity into the vestibule of the internal ear. Its long diameter is horizontal, and its convex border is upward. In the recent state it is occupied by the base of the stapes, the circumference of which is fixed by the annular ligament to the margin of the foramen. The Finestra cochleae, Finestra rotunda, is situated below and a little behind the Finestra vestibuli, from which it is separated by a rounded elevation, the promontory. It is placed at the bottom of a funnel-shaped depression, and, in the macerated bone, leads into the cochlea of the internal ear. In the fresh state it is closed by a membrane, the secondary tympanic membrane, which is concave towards the tympanic cavity, convex towards the cochlea. This membrane consists of three layers: an external or mucus, derived from the mucous lining of the tympanic cavity, an internal from the lining membrane of the cochlea, and an intermediate or fibrous layer. The promontory, promontorium, is a rounded hollow prominence formed by the projection outward of the first turn of the cochlea. It is placed between the fenestrae, and it is furrowed on its surface by small grooves for the lodgment of branches of the tympanic plexus. A minute spicule of bone frequently connects the promontory to the pyramidal eminence. The prominence of the facial canal, prominentia canalis facialis, prominence of aqueduct of Fallopius, indicates the position of the bony canal in which the facial nerve is contained. This canal traverses the labyrinthic wall of the tympanic cavity above the Finestra Vestibuli, and behind that opening curves nearly vertically downward along the mastoid wall. The mastoid or posterior wall, Parius mastoidea, is wider above than below, and presents for examination the entrance to the tympanic antrum, the pyramidal eminence, and the fossa incutis. The entrance to the antrum is a large irregular aperture, which leads backward from the epitympanic recess into a considerable air space, named the tympanic or mastoid antrum. The antrum communicates behind and below with the mastoid air cells, which vary considerably in number, size, and form. The antrum and mastoid air cells are lined by mucous membrane, continuous with that lining the tympanic cavity. On the medial wall of the entrance to the antrum is a rounded eminence, situated above and behind the prominence of the facial canal. It corresponds with the position of the ampullated ends of the superior and lateral semicircular canals. The pyramidal eminence, eminentia pyramidalis, pyramid, is situated immediately behind the Finestra Vestibuli, and in front of the vertical portion of the facial canal. It is hollow, and contains the stapedius muscle. Its summit projects forward toward the Finestra Vestibuli, and is pierced by a small aperture which transmits the tendon of the muscle. The cavity in the pyramidal eminence is prolonged downward and backward in front of the facial canal, and communicates with it by a minute aperture which transmits a twig from the facial nerve to the stapedius muscle. The fossa incutis is a small depression in the lower and back part of the epitympanic recess. It lodges the short crus of the incus. The carotid or anterior wall, Parius carotica, is wider above than below. It corresponds with the carotid canal, from which it is separated by a thin plate of bone perforated by the tympanic branch of the internal carotid artery, and by the deep petrosal nerve which connects the sympathetic plexus on the internal carotid artery with the tympanic plexus on the promontory. At the upper part of the anterior wall are the orifice of the semicanal for the tensor tympani muscle, and the tympanic orifice of the auditory tube, separated from each other by a thin horizontal plate of bone, the septum canalus musculotuberi. These canals run from the tympanic cavity forward and downward to the retiring angle between the squama and the petrous portion of the temporal bone. The semicanal for the tensor tympani, semicanalus and tensoris tympani, is the superior and the smaller of the two. It is cylindrical and lies beneath the tegmen tympani. It extends on to the labyrinthic wall of the tympanic cavity, and ends immediately above the Finestra Vestibuli. The septum canalis musculotuberi, processus cochleariformis, passes backward below this semicanal, forming its lateral wall and floor. It expands above the anterior end of the Finestra Vestibuli, and terminates there by curving laterally, so as to form a pulley over which the tendon of the muscle passes. The auditory tube, tuba auditiva, Eustachian tube, is a channel through which the tympanic cavity communicates with the nasal part of the pharynx. Its length is about 36 mm, and its direction is downward, forward, and medialward, forming an angle of about 45 degrees with the sagittal plane, and one from 30 to 40 degrees with the horizontal plane. It is formed partly of bone, partly of cartilage and fibrous tissue. The osseous portion, pars osseo tubi auditivi, is about 12 mm in length. It begins in the carotid wall of the tympanic cavity, below the septum canalus musculotuberi, and gradually narrowing, ends at the angle of junction of the squama and the petrous portion of the temporal bone, its extremity presenting a jagged margin which serves for the attachment of the cartilaginous portion. The cartilaginous portion, pars cartilaginea tubi auditivi, about 24 mm in length, is formed of a triangular plate of elastic fibrocartilage, the apex of which is attached to the margin of the medial end of the osseous portion of the tube. while its base lies directly under the mucous membrane of the nasal part of the pharynx, where it forms an elevation, the torus tubarius or cushion, behind the pharyngeal orifice of the tube. The upper edge of the cartilage is curled upon itself, being bent laterally so as to present on transverse section the appearance of a hook. A groove or furrow is thus produced, which is open below and laterally, and this part of the canal is completed by a fibrous membrane. The cartilage lies in a groove between the petrous part of the temporal and the great wing of the sphenoid. This groove ends opposite the middle of the medial pterygoid plate. The cartilaginous and bony portions of the tube are not in the same plane, the former inclining downward a little more than the latter. The diameter of the tube is not uniform throughout, being greatest at the pharyngeal orifice, least at the junction of the bony and cartilaginous portions, and again increased towards the tympanic cavity. The narrowest part of the tube is termed the isthmus. The position and relations of the pharyngeal orifice are described with the nasal part of the pharynx. The mucous membrane of the tube is continuous in front with that of the nasal part of the pharynx, and behind with that of the tympanic cavity. It is covered with ciliated epithelium, and is thin in the osseous portion, while in the cartilaginous portion it contains many mucous glands, and near the pharyngeal orifice a considerable amount of adenoid tissue, which has been named by Gerlach the tube tonsil. The tube is opened during deglutition by the salpingopharyngeus and dilatator tubi. The latter arises from the hook of the cartilage and from the membranous part of the tube, and blends below with the tensor villi palatini. End of section 57.
Of Gray's Anatomy Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Auditory Ossicles, Ossicula Auditus. The tympanic cavity contains a chain of 3 movable ossicles, the malleus, incus, and stapes. The first is attached to the tympanic membrane, the last to the circumference of the Finestra Vestibule, the incus being placed between and connected to both by delicate articulations. The malleus, so named from its fancied resemblance to a hammer, consists of a head, neck, and 3 processes. These are the manubrium, the anterior and lateral processes. The head, capitulum mallei, is the large upper extremity of the bone. It is oval in shape, and articulates posteriorly with the incus, being free in the rest of its extent. The facet for articulation with the incus is constricted near the middle, and consists of an upper, larger, and lower, smaller part, which form nearly a right angle with each other. Opposite the constriction, the lower margin of the facet projects in the form of a process, the cog tooth or spur of the malleus. The neck, column mallei, is the narrow contracted part just beneath the head. Below it is a prominence, to which the various processes are attached. The manubrium mallei, handle, is connected by its lateral margin with the tympanic membrane. It is directed downward, medialward, and backward. It decreases in size toward its free end, which is curved slightly forward, and flattened transversely. On its medial side, near its upper end, is a slight projection, into which the tendon of the tensor tympani is inserted. The anterior process, processus anterior, folii, processus gracilis, is a delicate spicule which springs from the eminence below the neck and is directed forward to the petrotympanic fissure, to which it is connected by ligamentous fibers. In the fetus this is the longest process of the malleus, and is in direct continuity with the cartilage of Meckel. The lateral process, processus lateralis, processus brevis, is a slight conical projection which springs from the root of the manubrium. It is directed laterally, and is attached to the upper part of the tympanic membrane, and, by means of the anterior and posterior malleolar folds, to the extremities of the notch of Rivinus. The incus has received its name from its supposed resemblance to an anvil, but it is more like a premolar tooth with two roots, which differ in length, and are widely separated from each other. It consists of a body and two crura. The body, corpus incudus, is somewhat cubical, but compressed transversely. On its anterior surface is a deeply concavo-convex facet, which articulates with the head of the malleus. The two crura diverge from one another nearly at right angles. The short crus breve, short process, somewhat conical in shape, projects almost horizontally backward, and is attached to the fossa incudus, in the lower and back part of the epitympanic recess. The long crus longum, long process, descends nearly vertically behind and parallel to the manubrium of the malleus, and bending medialward ends in a rounded projection, the lenticular process, which is tipped with cartilage and articulates with the head of the stapes. The stapes, so called from its resemblance to a stirrup, consists of a head, neck, two crura, and a base. The head, capitulum stapedis, presents a depression, which is covered by cartilage and articulates with the lenticular process of the incus. The neck, the constricted part of the bone succeeding the head, gives insertion to the tendon of the stapedius muscle. The two crura, crus anterius and crus posterius, diverge from the neck and are connected at their ends by a flattened oval plate, the base, basis stapedis, which forms the footplate of the stirrup, and is fixed to the margin of the Finestra Vestibule by a ring of ligamentous fibers. Of the two crura, the anterior is shorter and less curved than the posterior. Articulations of the Auditory Ossicles. Articulationes ossiculorum auditus. The incudo-malleolar joint is a saddle-shaped diarthrosis. It is surrounded by an articular capsule, and the joint cavity is incompletely divided into two by a wedge-shaped articular disc or meniscus. The incudostapedial joint is an inarthrosis, surrounded by an articular capsule. Some observers have described an articular disc or meniscus in this joint. Others regard the joint as a syndesmosis. Ligaments of the ossicles, ligamenta ossiculorum auditus. The ossicles are connected with the walls of the tympanic cavity by ligaments, 3 for the malleus, and 1 each for the incus and stapes. The anterior ligament of the malleus, ligamentum mallei anterius, is attached by one end to the neck of the malleus, just above the anterior process, and by the other to the anterior wall of the tympanic cavity, close to the petrotympanic fissure, some of its fibers being prolonged through the fissure to reach the spina angularis of the sphenoid. The superior ligament of the malleus, ligamentum mallei superius, is a delicate, round bundle which descends from the roof of the epitympanic recess to the head of the malleus. The lateral ligament of the malleus, ligamentum mallei laterali, external ligament of the malleus, is a triangular band passing from the posterior part of the notch of Rivenus to the head of the malleus. Helmholtz described the anterior ligament and the posterior part of the lateral ligament as forming together the axis ligament around which the malleus rotates. The posterior ligament of the incus, ligamentum incudus posterius, is a short, thick band connecting the end of the short crus of the incus to the fossa incudus. A superior ligament of the incus, ligamentum incudus superius, has been described, but it is little more than a fold of mucous membrane. The vestibular surface and the circumference of the base of the stapes are covered with hyaline cartilage. That encircling the base is attached to the margin of the Finestra Vestibule by a fibrous ring, the annular ligament of the base of the stapes, ligamentum annulare baseos stapedis. The muscles of the tympanic cavity, musculi ossiculorum auditus, are the tensor tympani and stapedius. The tensor tympani, the larger, is contained in the bony canal above the osseous portion of the auditory tube, from which it is separated by the septum canalis musculotubarii. It arises from the cartilaginous portion of the auditory tube and the adjoining part of the great wing of the sphenoid, as well as from the osseous canal in which it is contained. Passing backward through the canal, it ends in a slender tendon which enters the tympanic cavity, makes a sharp bend around the extremity of the septum, and is inserted into the manubrium of the malleus, near its root. It is supplied by a branch of the mandibular nerve through the otic ganglion. The stapedius arises from the wall of a conical cavity, hollowed out of the interior of the pyramidal eminence. Its tendon emerges from the orifice at the apex of the eminence, and, passing forward, is inserted into the posterior surface of the neck of the stapes. It is supplied by a branch of the facial nerve. Actions. The tensor tympani draws the tympanic membrane medialward, and thus increases its tension. The stapedius pulls the head of the stapes backward, and thus causes the base of the bone to rotate on a vertical axis drawn through its own center. The back part of the base is pressed inward toward the vestibule, while the fore part is withdrawn from it. By the action of the muscle the tension of the fluid within the internal ear is probably increased. The mucous membrane of the tympanic cavity is continuous with that of the pharynx through the auditory tube. It invests the auditory ossicles, and the muscles and nerves contained in the tympanic cavity, forms the medial layer of the tympanic membrane, and the lateral layer of the secondary tympanic membrane, and is reflected into the tympanic antrum and mastoid cells, which it lines throughout. It forms several vascular folds, which extend from the walls of the tympanic cavity of the ossicles. Of these, one descends from the root of the cavity to the head of the malleus and upper margin of the body of the incus. A second invests the stapedius muscle. Other folds invest the chorda tympani nerve and the tensor tympani muscle. These folds separate off pouch-like cavities and give the interior of the tympanum a somewhat honeycombed appearance. One of these pouches, the pouch of Prasac, is well marked and lies between the neck of the malleus and the membrana flaccida. Two other recesses may be mentioned. They are formed by the mucous membrane which envelops the chorda tympani nerve, and are situated, one in front of and the other behind the manubrium of the malleus. They are named the anterior and posterior recesses of Troeltsch. In the tympanic cavity this membrane is pale, thin, slightly vascular, and covered, for the most part, with columnar ciliated epithelium, but over the pyramidal eminence, ossicles, and tympanic membrane it possesses a flattened non-ciliated epithelium. In the tympanic antrum and mastoid cells its epithelium is also non-ciliated. In the osseous portion of the auditory tube the membrane is thin, but in the cartilaginous portion it is very thick, highly vascular, and provided with numerous mucous glands. The epithelium which lines the tube is columnar and ciliated. Vessels and nerves. The arteries are 6 in number. 2 of them are larger than the others. These are the tympanic branch of the internal maxillary, which supplies the tympanic membrane, and the stylomastoid branch of the posterior auricular, which supplies the back part of the tympanic cavity and mastoid cells. The smaller arteries are the petrosal branch of the middle meningeal, which enters through the hiatus of the facial canal, a branch from the ascending pharyngeal, and another from the artery of the pterygoid canal, which accompany the auditory tube, and the tympanic branch from the internal carotid, given off in the carotid canal and perforating the thin anterior wall of the tympanic cavity. The veins terminate in the pterygoid plexus and the superior petrosal sinus. The nerves constitute the tympanic plexus, which ramifies upon the surface of the promontory. The plexus is formed by 1. The tympanic branch of the glossopharyngeal, 2. The carodico-tympanic nerves, 3. The smaller superficial petrosal nerve, and 4. A branch which joins the greater superficial petrosal. The tympanic branch of the glossopharyngeal, Jacobson's nerve, enters the tympanic cavity by an aperture in its floor close to the labyrinthic wall, and divides into branches which ramify on the promontory and enter into the formation of the tympanic plexus. The superior and inferior carodico-tympanic nerves from the carotid plexus of the sympathetic pass through the wall of the carotid canal, and join the branches of the tympanic branch of the glossopharyngeal. The branch to the greater superficial petrosal passes through an opening on the labyrinthic wall, in front of the Finestra Vestibule. The smaller superficial petrosal nerve, from the otic ganglion, passes backward through a foramen in the middle fossil of the base of the skull, sometimes through the foramen ovale, and enters the anterior surface of the petrous part of the temporal bone through a small aperture, situated lateral to the hiatus of the facial canal. It courses downward through the bone, past the genicular ganglion of the facial nerve, receiving a connecting filament from it, and enters the tympanic cavity, where it communicates with the tympanic branch of the glossopharyngeal, and assists in forming the tympanic plexus. The branches of distribution of the tympanic plexus are supplied to the mucous membrane of the tympanic cavity. A branch passes to the Finestra Vestibule, another to the Finestra cochleae, and a third to the auditory tube. The smaller superficial petrosal may be looked upon as the continuation of the tympanic branch of the glossopharyngeal through the plexus to the otic ganglion. In addition to the tympanic plexus, there are the nerves supplying the muscles. The tensor tympani is supplied by a branch from the mandibular through the otic ganglion, and the stapedius by a branch from the facial. The chorda tympani nerve crosses the tympanic cavity. It is given off from the sensory part of the facial, about 6 mm before the nerve emerges from the stylomastoid foramen. It runs from below upward and forward in a canal, and enters the tympanic cavity through the iter chordae posterius, and becomes invested with mucous membrane. It traverses the tympanic cavity, crossing medial to the tympanic membrane and over the upper part of the manubrium of the malleus to the carotid wall, where it emerges through the iter chordae anterius, canal of Ugae. End of section 58.
Of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The Internal Ear or Labyrinth, Part 1. 1d4. The Internal Ear or Labyrinth. Oris interna. The internal ear is the essential part of the organ of hearing, receiving the ultimate distribution of the auditory nerve. It is called the labyrinth from the complexity of its shape, and consists of two parts: the osseous labyrinth, a series of cavities within the petrous part of the temporal bone, and the membranous labyrinth, a series of communicating membranous sacs and ducts contained within the bony cavities. The osseous labyrinth, Labyrinthus osseus. The osseous labyrinth consists of three parts: the vestibule, semicircular canals, and cochlea. These are cavities hollowed out of the substance of the bone and lined by periosteum. They contain a clear fluid, the perilymph, in which the membranous labyrinth is situated. The vestibule, vestibulum. The vestibule is the central part of the osseous labyrinth, and is situated medial to the tympanic cavity, behind the cochlea, and in front of the semicircular canals. It is somewhat ovoid in shape, but flattened transversely. It measures about 5 mm from before backward, and the same from above downward, and about 3 mm across. In its lateral or tympanic wall is the Finestra Vestibule, closed in the fresh state by the base of the stapes and annular ligament. On the medial wall, at the forepart, is a small circular depression, the recessus sphericus, which is perforated, at its anterior and inferior part, by several minute holes, macula cribrosa media, for the passage of filaments of the acoustic nerve to the saccule, and behind this depression is an oblique ridge, the crista vestibuli, the anterior end of which is named the pyramid of the vestibule. This ridge bifurcates below to enclose a small depression, the fossa cochlearis, which is perforated by a number of holes for the passage of filaments of the acoustic nerve which supply the vestibular end of the ductus cochlearis. At the hinder part of the medial wall is the orifice of the Aqueductus Vestibuli, which extends to the posterior surface of the petrous portion of the temporal bone. It transmits a small vein, and contains a tubular prolongation of the membranous labyrinth, the ductus endolymphaticus, which ends in a cul-de-sac between the layers of the dura mater within the cranial cavity. On the upper wall or roof is a transversely oval depression, the recessus ellipticus, separated from the recessus sphericus by the crista vestibuli already mentioned. The pyramid and adjoining part of the recessus ellipticus are perforated by a number of holes, macula cribrosa superior. The apertures in the pyramid transmit the nerves to the utricle, those in the recessus ellipticus the nerves to the ampullae of the superior and lateral semicircular ducts. Behind are the 5 orifices of the semicircular canals. In front is an elliptical opening, which communicates with the scala vestibuli of the cochlea. The bony semicircular canals, Canales semicircularis ossei. The bony semicircular canals are 3 in number, superior, posterior, and lateral, and are situated above and behind the vestibule. They are unequal in length, compressed from side to side, and each describes the greater part of a circle. Each measures about 0.8 mm in diameter, and presents a dilation at one end, called the ampulla, which measures more than twice the diameter of the tube. They open into the vestibule by 5 orifices, one of the apertures being common to 2 of the canals. The superior semicircular canal, Canalis semicircularis superior, 15 to 20 mm in length, is vertical in direction, and is placed transversely to the long axis of the petrous portion of the temporal bone, on the anterior surface of which its arch forms a round projection. It describes about 2/3 of a circle. Its lateral extremity is ampullated, and opens into the upper part of the vestibule. The opposite end joins with the upper part of the posterior canal to form the crus commune, which opens into the upper and medial part of the vestibule. The posterior semicircular canal, Canalis semicircularis posterior, also vertical, is directed backward, nearly parallel to the posterior surface of the petrous bone. It is the longest of the 3, measuring from 18 to 22 mm. Its lower or ampullated end opens into the lower and back part of the vestibule, its upper into the crus commune already mentioned. The lateral or horizontal canal, Canalis semicircularis lateralis, external semicircular canal, is the shortest of the 3. It measures from 12 to 15 mm, and its arch is directed horizontally backward and lateralward. Thus each semicircular canal stands at right angles to the other 2. Its ampullated end corresponds to the upper and lateral angle of the vestibule, just above the Finestra Vestibule, where it opens close to the ampullated end of the superior canal. Its opposite end opens at the upper and back part of the vestibule. The lateral canal of one ear is very nearly in the same plane as that of the other, while the superior canal of one ear is nearly parallel to the posterior canal of the other. The cochlea. The cochlea bears some resemblance to a common snail shell. It forms the anterior part of the labyrinth, is conical in form, and placed almost horizontally in front of the vestibule. Its apex, cupula, is directed forward and lateralward, with a slight inclination downward, toward the upper and front part of the labyrinthic wall of the tympanic cavity. Its base corresponds with the bottom of the internal acoustic meatus, and is perforated by numerous apertures for the passage of the cochlear division of the acoustic nerve. It measures about 5 mm from base to apex, and its breadth across the base is about 9 mm. It consists of a conical shaped central axis, the modiolus, of a canal, the inner wall of which is formed by the central axis, wound spirally around it for 2 turns and 3/4. From the base to the apex, and of a delicate lamina, the osseous spiral lamina, which projects from the modiolus, and, following the windings of the canal, partially subdivides it into 2. In the recent state a membrane, the basilar membrane, stretches from the free border of this lamina to the outer wall of the bony cochlea and completely separates the canal into 2 passages, which however communicate with each other at the apex of the modiolus by a small opening named the helicotrema. The modiolus is the conical central axis or pillar of the cochlea. Its base is broad and appears at the bottom of the internal acoustic meatus, where it corresponds with the area cochleae. It is perforated by numerous orifices, which transmit filaments of the cochlear division of the acoustic nerve. The nerves for the first turn and a half pass through the foramina of the Tractus Spiralis foraminosus, those for the apical turn through the foramen centrale. The canals of the Tractus Spiralis foraminosus pass up through the modiolus and successively bend outward to reach the attached margin of the lamina spiralis ossea. Here they become enlarged, and by their apposition form the spiral canal of the modiolus, which follows the course of the attached margin of the osseous spiral lamina and lodges the spiral ganglion of Corti. The foramen centrale is continued into a canal which runs up the middle of the modiolus to its apex. The modiolus diminishes rapidly in size in the second and succeeding coil. The bony canal of the cochlea takes 2 turns and 3/4 around the modiolus. It is about 30 mm in length, and diminishes gradually in diameter from the base to the summit, where it terminates in the cupula which forms the apex of the cochlea. The beginning of this canal is about 3 mm in diameter. It diverges from the modiolus toward the tympanic cavity and vestibule, and presents 3 openings. 1. The Finestra Cochleae communicates with the tympanic cavity. In the fresh state this aperture is closed by the secondary tympanic membrane. Another, of an elliptical form, opens into the vestibule. The third is the aperture of the aqueductus cochleae, leading to a minute funnel-shaped canal which opens on the inferior surface of the petrous part of the temporal bone and transmits a small vein, and also forms a communication between the subarachnoid cavity and the scala tympani. The osseous spiral lamina, lamina spiralis ossea, is a bony shelf or ledge which projects from the modiolus into the interior of the canal, and, like the canal, takes 2 3/4 turns around the modiolus. It reaches about halfway toward the outer wall of the tube, and partially divides its cavity into 2 passages or scalae, of which the upper is named the scala vestibuli, while the lower is termed the scala tympani. Near the summit of the cochlea the lamina ends in a hook-shaped process, the hamulus laminae spiralis. This assists in forming the boundary of the small opening, the helicotrema, through which the 2 scalae communicate with each other. From the spiral canal of the modiolus, numerous canals pass outward through the osseous spiral lamina as far as its free edge. In the lower part of the first turn a second bony lamina, the secondary spiral lamina, projects inward from the outer wall of the bony tube. It does not, however, reach the primary osseous spiral lamina, so that if viewed from the vestibule, a narrow fissure, the vestibule fissure, is seen between them. The osseous labyrinth is lined by an exceedingly thin fibroserous membrane. Its attached surface is rough and fibrous, and closely adherent to the bone. Its free surface is smooth and pale, covered with a layer of epithelium, and secretes a thin, limpid fluid, the perilymph. A delicate tubular process of this membrane is prolonged along the aqueduct of the cochlea to the inner surface of the dura mater. The membranous labyrinth. Labyrinthus membranaceus. The membranous labyrinth is lodged within the bony cavities just described, and has the same general form as these. It is, however, considerably smaller, and is partly separated from the bony walls by a quantity of fluid, the perilymph. In certain places it is fixed to the walls of the cavity. The membranous labyrinth contains fluid, the endolymph, and on its walls the ramifications of the acoustic nerve are distributed. Within the osseous vestibule the membranous labyrinth does not quite preserve the form of the bony cavity, but consists of 2 membranous sacs, the utricle and the saccule. The utricle, utriculus. The utricle, the larger of the 2, is of an oblong form, compressed transversely, and occupies the upper and back part of the vestibule, lying in contact with the recessus ellipticus and the part below it. That portion which is lodged in the recess forms a sort of pouch or cul-de-sac, the floor and anterior wall of which are thickened, and form the macula acoustica utriculi, which receives the utricular filaments of the acoustic nerve. The cavity of the utricle communicates behind with the semicircular ducts by 5 orifices. From its anterior wall is given off the ductus utriculo-saccularis, which opens into the ductus endolymphaticus. The saccule, sacculus. The saccule is the smaller of the 2 vestibular sacs. It is globular in form, and lies in the recessus sphericus near the opening of the scala vestibuli of the cochlea. Its anterior part exhibits an oval thickening, the macula acoustica sacculi, to which are distributed the saccular filaments of the acoustic nerve. Its cavity does not directly communicate with that of the utricle. From the posterior wall a canal, the ductus endolymphaticus, is given off. This duct is joined by the ductus utriculo-saccularis, and then passes along the aqueductus vestibuli and ends in a blind pouch, saccus endolymphaticus, on the posterior surface of the petrous portion of the temporal bone, where it is in contact with the dura mater. From the lower part of the saccule a short tube, the canalis reuniens of Hensen, passes downward and opens into the ductus cochlearis near its vestibular extremity. The semicircular ducts. Ductus semicircularis, membranous semicircular canals. The semicircular ducts are about 1/4 of the diameter of the osseous canals, but in number, shape, and general form they are precisely similar, and each presents at one end an ampulla. They open by 5 orifices into the utricle, one opening being common to the medial end of the superior and the upper end of the posterior duct. In the ampullae the wall is thickened and projects into the cavity as a fiddle-shaped, transversely placed elevation, the septum transversum, in which the nerves end. The utricle, saccule, and semicircular ducts are held in position by numerous fibrous bands which stretch across the space between them and the bony walls. Structure. The walls of the utricle, saccule, and semicircular ducts consist of 3 layers. The outer layer is a loose and flocculent structure, apparently composed of ordinary fibrous tissue containing blood vessels and some pigment cells. The middle layer, thicker and more transparent, forms a homogeneous membrana propria, and presents on its internal surface, especially in the semicircular ducts, numerous papilliform projections, which, on the addition of acetic acid, exhibit an appearance of longitudinal fibrillation. The inner layer is formed of polygonal nucleated epithelial cells. In the maculae of the utricle and saccule, and in the transverse septa of the ampullae of the semicircular ducts, the middle coat is thickened, and the epithelium is columnar, and consists of supporting cells and hair cells. The former are fusiform, and their deep ends are attached to the membrana propria, while their free extremities are united to form a thin cuticle. The hair cells are flask-shaped, and their deep, rounded ends do not reach the membrana propria, but lie between the supporting cells. The deep part of each contains a large nucleus, while its more superficial part is granular and pigmented. The free end is surmounted by a long, tapering, hair-like filament which projects into the cavity. The filaments of the acoustic nerve enter these parts, and having pierced the outer and middle layers, they lose their medullary sheaths, and their axis cylinders ramify between the hair cells. 2 rounded bodies, termed otoconia, each consisting of a mass of minute crystalline grains of carbonate of lime, held together in a mesh of gelatinous tissue, are suspended in the endolymph in contact with the free ends of the hairs projecting from the maculae. According to Bowman, a calcareous material is also sparingly scattered in the cells lining the ampullae of the semicircular ducts. End of section 59. Section 60 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The Internal Ear or Labyrinth, Part 2. The ductus cochlearis, membranous cochlea, scala media. The ductus cochlearis consists of a spirally arranged tube enclosed in the bony canal of the cochlea and lying along its outer wall. As already stated, the osseous spiral lamina extends only part of the distance between the modiolus and the outer wall of the cochlea, while the basilar membrane stretches from its free edge to the outer wall of the cochlea and completes the roof of the scala tympani. A second and more delicate membrane, the vestibular membrane, res neri, extends from the thickened periosteum covering the osseous spiral lamina to the outer wall of the cochlea, where it is attached at some little distance above the outer edge of the basilar membrane. A canal is thus shut off between the scala tympani below and the scala vestibuli above. This is the ductus cochlearis, or scala media. It is triangular on transverse section, its roof being formed by the vestibular membrane, its outer wall by the periosteum lining the bony canal, and its floor by the membrana basilaris and the outer part of the lamina spiralis ossea. Its extremities are closed. The upper is termed the lagina, and is attached to the cupula at the upper part of the helicotrema. The lower is lodged in the recessus cochlearis of the vestibule. Near the lower end, the ductus cochlearis is brought into continuity with the saccule by a narrow short canal, the canalis reunions of Hensen. On the membrana basilaris is situated the spiral organ of Corti. The vestibular membrane is thin and homogeneous, and is covered on its upper and under surfaces by a layer of epithelium. The periosteum, forming the outer wall of the ductus cochlearis, is greatly thickened and altered in character, and is called the spiral ligament. It projects inward below as a triangular prominence, the basilar crest, which gives attachment to the outer edge of the basilar membrane. Immediately above the crest is a concavity, the sulcus spiralis externus. The upper portion of the spiral ligament contains numerous capillary loops and small blood vessels, and is termed the stria vascularis. The osseous spiral lamina consists of two plates of bone, and between these are the canals for the transmission of the filaments of the acoustic nerve. On the upper plate of that part of the lamina which is outside the vestibular membrane, the periosteum is thickened to form the limbus laminae spiralis. This ends externally in a concavity, the sulcus spiralis internus, which represents, on section, the form of the letter C. The upper part, formed by the overhanging extremity of the limbus, is named the vestibular lip. The lower part, prolonged and tapering, is called the tympanic lip, and is perforated by numerous foramina for the passage of the cochlear nerves. The upper surface of the vestibular lip is intersected at right angles by a number of furrows, between which are numerous elevations. These present the appearance of teeth along the free surface and margin of the lip, and have been named by Husker the auditory teeth. The limbus is covered by a layer of what appears to be squamous epithelium, but the deeper parts of the cells with their contained nuclei occupy the intervals between the elevations and between the auditory teeth. This layer of epithelium is continuous on the one hand with that lining the sulcus spiralis internus, and on the other with that covering the under surface of the vestibular membrane. Basilar membrane. The basilar membrane stretches from the tympanic lip of the osseous spiral lamina to the basilar crest, and consists of two parts, an inner and an outer. The inner is thin, and is named the zona arcuata. It supports the spiral organ of Corti. The outer is thicker and striated, and is termed the zona pectinata. The under surface of the membrane is covered by a layer of vascular connective tissue. One of the vessels in this tissue is somewhat larger than the rest, and is named the vas spirale. It lies below Corti's tunnel. The spiral organ of Corti, organon spirale, Corti, organ of Corti, is composed of a series of epithelial structures placed upon the inner part of the basilar membrane. The more central of these structures are two rows of rod-like bodies, the inner and outer rods or pillars of Corti. The bases of the rods are supported on the basilar membrane, those of the inner row at some distance from those of the outer, the two rows inclined toward each other and, coming into contact above, enclose between them and the basilar membrane a triangular tunnel, the tunnel of Corti. On the inner side of the inner rods is a single row of hair cells, and on the outer side of the outer rods 3 or 4 rows of similar cells, together with certain supporting cells termed the cells of Dieter's and Hensen. The free ends of the outer hair cells occupy a series of apertures in a net-like membrane, the reticular membrane, and the entire organ is covered by the tectorial membrane. Rods of Corti. Each of these consists of a base or footplate, and elongated part or body, and an upper end or head. The body of each rod is finely striated, but in the head there is an oval, non-striated portion which stains deeply with carmine. Occupying the angles between the rods and the basilar membrane are nucleated cells which partly envelop the rods and extend on to the floor of Corti's tunnel. These may be looked upon as the undifferentiated parts of the cells from which the rods have been formed. The inner rods number nearly 6,000, and their bases rest on the basilar membrane close to the tympanic lip of the sulcus spiralis internus. The shaft or body of each is sinuously curved and forms an angle of about 60 degrees with the basilar membrane. The head resembles the proximal end of the ulna, and presents a deep concavity which accommodates a convexity on the head of the outer rod. The head plate or portion overhanging the concavity overlaps the head plate of the outer rod. The outer rods, nearly 4,000 in number, are longer and more obliquely set than the inner, forming with the basilar membrane an angle of about 40 degrees. Their heads are convex internally. They fit into the concavities on the heads of the inner rods and are continued outward as thin flattened plates, termed phalangeal processes, which unite with the phalangeal processes of Dieter's cells to form the reticular membrane. Hair cells. The hair cells are short columnar cells. Their free ends are on a level with the heads of Corti's rods, and each is surmounted by about 20 hair-like processes, arranged in the form of a crescent with its concavity directed inward. The deep ends of the cells reach about halfway along Corti's rods, and each contains a large nucleus. In contact with the deep ends of the hair cells are the terminal filaments of the cochlear division of the acoustic nerve. The inner hair cells are arranged in a single row on the medial side of the inner rods, and their diameters being greater than those of the rods, it follows that each hair cell is supported by more than one rod. The free ends of the inner hair cells are encircled by a cuticular membrane which is fixed to the heads of the inner rods. Adjoining the inner hair cells are 1 or 2 rows of columnar supporting cells, which, in turn, are continuous with the cubical cells lining the sulcus spiralis internus. The outer hair cells number about 12,000, and are nearly twice as long as the inner. In the basal coil of the cochlea they are arranged in 3 regular rows, in the apical coil in 4 somewhat irregular rows. Between the rows of the outer hair cells are rows of supporting cells, called the cells of Dieter's. Their expanded bases are planted on the basilar membrane, while the opposite end of each presents a clubbed extremity or phalangeal process. Immediately to the outer side of Dieter's cells are 5 or 6 rows of columnar cells, the supporting cells of Hensen. Their bases are narrow, while their upper parts are expanded and form a rounded elevation on the floor of the ductus cochlearis. The columnar cells lying outside Hensen's cells are termed the cells of Claudius. A space exists between the outer rods of Corti and the adjacent hair cells. This is called the space of Newell. The rectangular lamina is a delicate framework perforated by rounded holes, which are occupied by the free ends of the outer hair cells. It extends from the heads of the outer rods of Corti to the external row of the outer hair cells, and is formed by several rows of minute fiddle-shaped cuticular structures, called phalanges, between which are circular apertures containing the free ends of the hair cells. The innermost row of phalanges consists of the phalangeal processes of the outer rods of Corti. The outer rows are formed by the modified free ends of Dieter's cells. Covering the sulcus spiralis internus and the spiral organ of Corti is the tectorial membrane, which is attached to the limbus laminae spiralis close to the inner edge of the vestibular membrane. Its inner part is thin and overlies the auditory teeth of Huschka. Its outer part is thick, and along its lower surface, opposite the inner hair cells, is a clear band, named Hensen's stripe, due to the intercrossing of its fibres. The lateral margin of the membrane is much thinner. Hardesty considers the tectorial membrane as the vibrating mechanism in the cochlea. It is inconceivably delicate and flexible, far more sensitively flexible in the transverse than in the longitudinal direction, and the readiness with which it bends when touched is beyond description. It is ectodermal in origin. It consists of fine, colourless fibres embedded in a transparent matrix. The matrix may be a variety of soft keratin, of a soft collagenous, semi-solid character with marked adhesiveness. The general transverse direction of the fibres inclines from the radius of the cochlea toward the apex. The acoustic nerve, nervus acousticus, auditory nerve or nerve of hearing, divides near the bottom of the internal acoustic meatus into an anterior or cochlear and a posterior or vestibular branch. The vestibular nerve, nervus vestibularis, supplies the utricle, the saccule, and the ampullae of the semicircular ducts. On the trunk of the nerve, within the internal acoustic meatus, is a ganglion, the vestibular ganglion, ganglion of Scarpa. The fibres of the nerve arise from the cells of this ganglion. On the distal side of the ganglion the nerve splits into a superior, an inferior, and a posterior branch. The filaments of the superior branch are transmitted through the foramina in the area vestibularis superior, and end in the macula of the utricle and in the ampullae of the superior and lateral semicircular ducts. Those of the inferior branch traverse the foramina in the area vestibularis inferior, and end in the macula of the saccule. The posterior branch runs through the foramen singulare at the postero-inferior part of the bottom of the meatus, and divides into filaments for the supply of the ampulla of the posterior semicircular duct. The cochlear nerve, nervus cochlearis, divides into numerous filaments at the base of the modiolus. Those for the basal and middle coils pass through the foramina in the tractus spiralis foraminosus. Those for the apical coil through the canalis centralis, and the nerves bend outward to pass between the lamellae of the osseous spiral lamina. Occupying the spiral canal of the modiolus is the spiral ganglion of the cochlea, ganglion of Corti, consisting of bipolar nerve cells, which constitute the cells of origin of this nerve. Reaching the outer edge of the osseous spiral lamina, the fibres of the nerve pass through the foramina in the tympanic lip. Some end by arborizing around the bases of the inner hair cells, while others pass between Corti's rods and across the tunnel, to end in a similar manner in relation to the outer hair cells. The cochlear nerve gives off a vestibular branch to supply the vestibular end of the ductus cochlearis. The filaments of this branch pass through the foramina in the fossa cochlearis. Vessels. The arteries of the labyrinth are the internal auditory, from the basilar, and the stylomastoid, from the posterior auricula. The internal auditory artery divides at the bottom of the internal acoustic meatus into two branches, cochlear and vestibular. The cochlear branch subdivides into 12 or 14 twigs, which traverse the canals in the modiolus, and are distributed, in the form of a capillary network, in the lamina spiralis and basilar membrane. The vestibular branches are distributed to the utricle, saccule, and semicircular ducts. The veins of the vestibule and semicircular canals accompany the arteries and, receiving those of the cochlea at the base of the modiolus, unite to form the internal auditory veins, which end in the posterior part of the superior petrosal sinus, or in the transverse sinus. End of section 60.
One of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 1E. Peripheral terminations of nerves of general sensations. The peripheral terminations of the nerves associated with general sensations, i.e., the muscular sense and the senses of heat, cold, pain, and pressure, are widely distributed throughout the body. These nerves may end free among the tissue elements, or in special end organs, where the terminal nerve filaments are enclosed in capsules. Free nerve endings occur chiefly in the epidermis and in the epithelium covering certain mucous membranes. They are well seen also in the stratified squamous epithelium of the corona, and are also found in the root sheaths and papillae of the hairs and around the bodies of the sudoriferous glands. When the nerve fiber approaches its termination, the medullary sheath suddenly disappears, leaving only the axis cylinder surrounded by the neurolemma. After a time, the fiber loses its neurolemma and consists only of an axis cylinder, which can be seen in preparation stained with chloride of gold, to be made up of fine varicose fibrillae. Finally, the axis cylinder breaks up into its constituent fibrillae, which often present regular varicosities and anastomose with one another, and end in small knobs or discs between the epithelial cells. Under this heading may be classed the tactile disks described by Merkel as occurring in the epidermis of the pig's snout, where the fibrillae of the axis cylinder end in cup-shaped discs in apposition with large epithelial cells. The special end organs exhibit great variety in size and shape, but have one feature in common, viz., the terminal nerve fibrillae are enveloped by a capsule. Included in this group are the end bulbs of Krauss, the corpuscles of Grandry, of Pacini, of Golgi and Mazzoni, of Wagner and Meissner, and the neurotendinous and neuromuscular spindles. The end bulbs of Krauss are minute cylindrical or oval bodies, consisting of a capsule formed by the expansion of the connective tissue sheath of a metallated fiber, and containing a soft semifluid core in which the axis cylinder terminates either in a bulbous extremity or in a coiled up plexiform mass. End bulbs are found in the conjunctiva of the eye, where they are spheroidal in shape in man, but cylindrical in most other animals. In the mucous membrane of the lips and tongue, and in the epineurium of nerve trunks. They are also found in the penis and the clitoris, and have received the name of genital corpuscles. In these situations they have a mulberry-like appearance, being constricted by connective tissue septa into from 2 to 6 knob-like masses. In the synovial membranes of certain joints, e.g., those of the fingers, rounded or oval end bulbs occur, and are designated articular end bulbs. The tactile corpuscles of Grandi occur in the papillae of the beak and tongue of birds. Each consists of a capsule composed of a very delicate nucleated membrane, and contains 2 or more granular, somewhat flattened cells. Between these cells the axis cylinder ends in flattened discs. The Pacinian corpuscles are found in the subcutaneous tissue on the nerves of the palm of the hand and sole of the foot, and in the genital organs of both sexes. They also occur in connection with the nerves of the joints, and in some other situations, as in the mesentery and pancreas of the cat, and along the tibia of the rabbit. Each of these corpuscles is attached to and encloses the termination of a single nerve fiber. The corpuscle, which is perfectly visible to the naked eye, and which can be most easily demonstrated in the mesentery of a cat, consists of a number of lamella or capsules arranged more or less concentrically around a central clear space, in which the nerve fiber is contained. Each lamella is composed of bundles of fine connective tissue fibers, and is lined on its inner surface by a single layer of flattened epithelioid cells. The center clear space, which is elongated or cylindrical in shape, is filled with a transparent core, in the middle of which the axis cylinder transverses the space to near its distal extremity, where it ends in 1 or more small knobs. Todd and Bowman have described minute arteries as entering by the sides of the nerves, and forming capillary loops in the intercapsular spaces, and even penetrating into the central space. Herbst has described a nerve ending somewhat similar to the Pacinian corpuscle, in the mucous membrane of the tongue of the duck, and in some other situations. It differs, however, from the Pacinian corpuscle in being smaller, in its capsules being more closely approximated, and especially in the act that the axis cylinder in the central clear space is coated with a continuous row of nuclei. These bodies are known as the corpuscles of Herbst. The corpuscles of Golgi and Mazzoni are found in the subcutaneous tissue of the pulp of the fingers. They differ from Pacinian corpuscles in that their capsules are thinner, their contained cores thicker, and in the latter the axis cylinders ramify more extensively and end in flat expansions. The tactile corpuscles of Wagner and Meissner are oval-shaped bodies. Each is enveloped by a connective tissue capsule, and imperfect membranous septa derived from this penetrate the interior. The axis cylinder passes through the capsule, and after making several spiral turns around the body of the corpuscle, ends in small globular or pyriform enlargements. These tactile corpuscles occur in the papillae of the corium of the hand and foot, the front of the forearm, the skin of the lips, the mucous membrane of the tip of the tongue, the palpable conjunctiva, and the skin of the mammary papilla. Corpuscles of Ruffini. Ruffini described a special variety of nerve endings in the subcutaneous tissue of the human finger. They are principally situated at the junction of the corium with the subcutaneous tissue. They are oval in shape and consist of strong connective tissue sheaths, inside which the nerve fibers divide into numerous branches, which show varicosities and end in small free knobs. The neurotendinous spindles, organs of Golgi, are chiefly found near the junctions of tendons and muscles. Each is enclosed in a capsule which contains a number of enlarged tendon fasciculi, intrafusal fasciculi. One or more nerve fibers perforate the side of the capsule and lose their medullary sheaths. The axis cylinders subdivide and end between the tendon fibers in irregular discs or varicosities. The neuromuscular spindles are present in the majority of voluntary muscles, and consist of small bundles of particular muscular fibers, intrafusal fibers, embryonic in type, invested by capsules, within which nerve fibers, experimentally shown to be sensory in origin, terminate. These neuromuscular spindles vary in length from 0.8 mm to 5 mm, and have a distinctly fusiform appearance. The large medullated nerve fibers passing to the end organ are from 1 to 3 or 4 in number. Entering the fibrous capsule, they divide several times and, losing their medullary sheaths, ultimately end in naked axis cylinders encircling the intrafusal fibers by flattened expansions, or irregular ovoid or rounded discs. Neuromuscular spindles have not yet been demonstrated in the tongue muscles, and only a few exist in the ocular muscles. End of section 61. Recording by David Lawrence in Brampton, Ontario, September 2009.
Of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Common Integument, Part 1. Integumentum commune, Skin. The integument covers the body and protects the deeper tissues from injury, from drying, and from invasion by foreign organisms. It contains the peripheral endings of many of the sensory nerves. It plays an important part in the regulation of the body temperature, and has also limited excretory and absorbing powers. It consists principally of a layer of vascular connective tissue named the corium or cutis vera, and an external covering of epithelium termed the epidermis or cuticle. On the surface of the former layer are sensitive and vascular papillae. Within or beneath it are certain organs with special functions, namely the sudoriferous and sebaceous glands and the hair follicles. The epidermis, cuticle, or scarf skin is non-vascular, and consists of stratified epithelium, and is accurately molded on the papillary layer of the corium. It varies in thickness in different parts. In some situations, as in the palms of the hands and soles of the feet, it is thick, hard, and horny in texture. This may be in a measure due to the fact that these parts are exposed to intermittent pressure, but that this is not the only cause is proved by the fact that the condition exists to a very considerable extent at birth. The more superficial layers of cells, called the horny layer, stratum corneum, may be separated by maceration from a deeper stratum, which is called the stratum mucosum, and which consists of several layers of differently shaped cells. The free surface of the epidermis is marked by a network of linear furrows of variable size, dividing the surface into a number of polygonal or lozenge-shaped areas. Some of these furrows are large, as opposite the flexures of the joints, and correspond to the folds in the corium produced by movements. In other situations, as upon the back of the hand, they are exceedingly fine, and intersect one another at various angles. Upon the palmar surfaces of the hands and fingers, and upon the soles of the feet, the epidermal ridges are very distinct, and are disposed in curves. They depend upon the large size and peculiar arrangements of the papillae, upon which the epidermis is placed. The function of these ridges is primarily to increase resistance between contact surfaces for the purpose of preventing slipping, whether in walking or prehension. The direction of the ridges is at right angles with the force that tends to produce slipping, or to the resultant of such forces, when these forces vary in direction. Professor Arthur Thomson of Oxford suggests that the contraction of these muscles on follicles which contain weak, flat hairs will tend to produce a permanent curve in the follicle, and this curve will be impressed on the hair which is molded within it, so that the hair, on emerging through the skin, will be curled. Curved hair follicles are characteristic of the scalp of the Bushman. In each individual the lines on the tips of the fingers and thumbs form distinct patterns unlike those of any other person. A method of determining the identity of a criminal is based on this fact, impressions, fingerprints, of these lines being made on paper covered with soot, or on white paper after first covering the fingers with ink. The deep surface of the epidermis is accurately molded upon the papillary layer of the corium, the papillae being covered by a basement membrane, so that when the epidermis is removed by maceration, it presents on its undersurface a number of pits or depressions corresponding to the papillae, and ridges corresponding to the intervals between them. Fine tubular prolongations are continued from this layer into the ducts of the sudoriferous and sebaceous glands. The epidermis consists of stratified epithelium which is arranged in 4 layers from within outward as follows: A. Stratum mucosum, B. Stratum granulosum, C. Stratum lucidum, and D. Stratum corneum. The stratum mucosum (mucous layer) is composed of several layers of cells. Those of the deepest layer are columnar in shape, and placed perpendicularly on the surface of the basement membrane, to which they are attached by toothed extremities. This deepest layer is sometimes termed the stratum germinativum. The succeeding strata consist of cells of a more rounded or polyhedral form, the contents of which are soft, opaque, granular, and soluble in acetic acid. These are known as prickle cells, because of the bridges by which they are connected to one another. They contain fine fibrils which are continuous across the connecting processes, with corresponding fibrils in adjacent cells. Between the bridges are fine intercellular clefts serving for the passage of lymph, and in these lymph corpuscles or pigment granules may be found. The stratum granulosum comprises 2 or 3 layers of flattened cells which contain granules of alidin, a substance readily stained by hematoxylin or carmine, and probably an intermediate substance in the formation of keratin. They are supposed to be cells in a transitional stage between the protoplasmic cells of the stratum mucosum and the horny cells of the superficial layers. The stratum lucidum appears in section as a homogeneous or dimly striated membrane, composed of closely packed cells in which traces of flattened nuclei may be found, and in which minute granules of a substance named keratohyalin are present. The stratum corneum (horny layer) consists of several layers of horny epithelial scales in which no nuclei are discernible, and which are unaffected by acetic acid, the protoplasm having become changed into horny material or keratin. According to Ranvier, they contain granules of a material which has the characteristics of beeswax. The black color of the skin in the negro, and the tawny color among some of the white races, is due to the presence of pigment in the cells of the epidermis. This pigment is more especially distinct in the cells of the stratum mucosum, and is similar to that found in the cells of the pigmentary layer of the retina. As the cells approach the surface and desiccate, the color becomes partially lost. The disappearance of the pigment from the superficial layers of the epidermis is, however, difficult to explain. The pigment, melanin, consists of dark brown or black granules of very small size, closely packed together within the cells, but not involving the nucleus. The main purpose served by the epidermis is that of protection; as the surface is worn away, new cells are supplied, and thus the true skin, the vessels and nerves which it contains, are defended from damage. The corium, cutis vera, dermis, or true skin, is tough, flexible, and highly elastic. It varies in thickness in different parts of the body. Thus it is very thick in the palms of the hand and soles of the feet, thicker on the posterior aspect of the body than on the front, and on the lateral than on the medial sides of the limbs. In eyelids, scrotum, and penis it is exceedingly thin and delicate. It consists of felted connective tissue with a varying amount of elastic fibers and numerous blood vessels, lymphatics, and nerves. The connective tissue is arranged in two layers, a deeper or reticular, and a superficial or papillary. Unstriped muscular fibers are found in the superficial layers of the corium, wherever hairs are present, and in the subcutaneous areolar tissue of the scrotum, penis, labia majora, and nipples. In the nipples the fibers are disposed in bands, closely reticulated and arranged in superimposed laminae. The reticular layer, stratum reticulare, deep layer, consists of strong interlacing bands, composed chiefly of white fibrous tissue, but containing some fibers of yellow elastic tissue, which vary in number in different parts, and connective tissue corpuscles, which are often to be found flattened against the white fibrous tissue bundles. Toward the attached surface the fasciculi are large and coarse, and the areolae left by their interlacement are large, and occupied by adipose tissue and sweat glands. Below the reticular layer is the subcutaneous areolar tissue, which, except in a few situations, contains fat. The papillary layer, stratum papillare, superficial layer, corpus papillare of the corium, consists of numerous small, highly sensitive, and vascular eminences, the papillae, which rise perpendicularly from its surface. The papillae are minute conical eminences, having rounded or blunted extremities, occasionally divided into two or more parts, and are received into corresponding pits on the undersurface of the cuticle. On the general surface of the body, more especially in parts endowed with slight sensibility, they are few in number and exceedingly minute. But in some situations, as upon the palmar surfaces of the hands and fingers, and upon the plantar surfaces of the feet and toes, they are long, of large size, closely aggregated together, and arranged in parallel curved lines, forming the elevated ridges seen on the free surface of the epidermis. Each ridge contains two rows of papillae, between which the ducts of the sudoriferous glands pass outward to open on the summit of the ridge. Each papilla consists of very small and closely interlacing bundles of finely fibrillated tissue, with a few elastic fibers. Within this tissue is a capillary loop, and in some papillae, especially in the palms of the hands and the fingers, there are tactile corpuscles. Development. The epidermis and its appendages, consisting of the hairs, nails, sebaceous and sweat glands, are developed from the ectoderm, while the corium, or true skin, is of mesodermal origin. About the 5th week the epidermis consists of two layers of cells, the deeper one corresponding to the rete mucosum. The subcutaneous fat appears about the 4th month, and the papillae of the true skin about the 6th. A considerable desquamation of epidermis takes place during fetal life, and this desquamated epidermis, mixed with sebaceous secretion, constitutes the vernix caseosa with which the skin is smeared during the last 3 months of fetal life. The nails are formed at the 3rd month, and begin to project from the epidermis about the 6th. The hairs appear between the 3rd and 4th months, in the form of solid down growths of the deeper layer of the epidermis, the growing extremities of which become inverted by papillary projections from the corium. The central cells of the solid down growths undergo alteration to form the hair, while the peripheral cells are retained to form the lining cells of the hair follicle. About the 5th month the fetal hairs, lanugo, appear, first on the head and then on the other parts. They drop off after birth and give place to the permanent hairs. The cellular structures of the sudoriferous and sebaceous glands are formed from the ectoderm, while the connective tissue and blood vessels are derived from the mesoderm. All the sweat glands are fully formed at birth; they begin to develop as early as the 4th month. The arteries supplying the skin form a network in the subcutaneous tissue, and from this network branches are given off to supply the sudoriferous glands, the hair follicles, and the fat. Other branches unite in a plexus immediately beneath the corium. From this plexus fine capillary vessels pass into the papillae, forming, in the smaller ones, a single capillary loop, but in the larger, a more or less convoluted vessel. The lymphatic vessels of the skin form two networks, superficial and deep, which communicate with each other and with those of the subcutaneous tissue by oblique branches. The nerves of the skin terminate partly in the epidermis and partly in the corium. Their different modes of ending are described on pages 1059 to 1061. End of section 62. Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Common Integument, Part 2. The appendages of the skin. The appendages of the skin are the nails, the hairs, and the sudoriferous and sebaceous glands with their ducts. The nails, ungues, are flattened elastic structures of a horny texture, placed upon the dorsal surfaces of the terminal phalanges of the fingers and toes. Each nail is convex on its outer surface, concave within, and is implanted by a portion, called the root, into a groove in the skin. The exposed portion is called the body, and the distal extremity the free edge. The nail is firmly adherent to the corium, being accurately molded upon its surface. The part beneath the body and root of the nail is called the nail matrix, because from it the nail is produced. Under the greater part of the body of the nail, the matrix is thick and raised into a series of longitudinal ridges which are very vascular, and the color is seen through the transparent tissue. Near the root of the nail the papillae are smaller, less vascular, and have no regular arrangement, and here the tissue of the nail is not firmly adherent to the connective tissue stratum, but only in contact with it. Hence this portion is of a whiter color, and is called the lunula on account of its shape. The cuticle, as it passes forward on the dorsal surface of the finger or toe, is attached to the surface of the nail a little in advance of its root. At the extremity of the finger it is connected with the under surface of the nail a little behind its free edge. The cuticle and the horny substance of the nail, both epidermic structures, are thus directly continuous with each other. The superficial horny part of the nail consists of a greatly thickened stratum lucidum, the stratum corneum forming merely the thin cuticular fold, eponychium, which overlaps the lunula. The deeper part consists of the stratum mucosum. The cells in contact with the papillae of the matrix are columnar in form, and arranged perpendicularly to the surface. Those which succeed them are of a rounded or polygonal form, the more superficial ones becoming broad, thin, and flattened, and so closely packed as to make the limits of the cells very indistinct. The nails grow in length by the proliferation of the cells of the stratum mucosum at the root of the nail, and in thickness from that part of the stratum mucosum which underlies the lunula. Hairs, pillae, are found on nearly every part of the surface of the body, but are absent from the palms of the hands, the soles of the feet, the dorsal surfaces of the terminal phalanges, the glans penis, the inner surface of the prepuce, and the inner surfaces of the labia. They vary much in length, thickness, and color in different parts of the body, and in different races of mankind. In some parts, as in the skin of the eyelids, they are so short as not to project beyond the follicles containing them. In others, as upon the scalp, they are of considerable length. Again, in other parts, as the eyelashes, the hairs of the pubic region, and the whiskers and beard, they are remarkable for their thickness. Straight hairs are stronger than curly hairs, and present on transverse section a cylindrical or oval outline. Curly hairs, on the other hand, are flattened. A hair consists of a root, the part implanted in the skin, and a shaft or scapus, the portion projecting from the surface. The root of the hair, radix pili, ends in an enlargement, the hair bulb, which is whiter in color and softer in texture than the shaft, and is lodged in a follicular involution of the epidermis called the hair follicle. When the hair is of considerable length, the follicle extends into the subcutaneous cellular tissue. The hair follicle commences on the surface of the skin with a funnel-shaped opening, and passes inward in an oblique or curved direction, the latter in curly hairs, to become dilated at its deep extremity, where it corresponds with the hair bulb. Opening into the follicle, near its free extremity, are the ducts of one or more sebaceous glands. At the bottom of each hair follicle is a small, conical, vascular eminence or papilla, similar in every respect to those found upon the surface of the skin. It is continuous with the dermic layer of the follicle, and is supplied with nerve fibrils. The hair follicle consists of two coats, an outer or dermic, and an inner or epidermic. The outer or dermic coat is formed mainly of fibrous tissue. It is continuous with the corium, is highly vascular, and supplied by numerous minute nervous filaments. It consists of 3 layers. The most internal is a hyaline basement membrane, which is well marked in the larger hair follicles, but is not very distinct in the follicles of minute hairs. It is limited to the deeper part of the follicle. Outside this is a compact layer of fibers and spindle-shaped cells arranged circularly around the follicle. This layer extends from the bottom of the follicle as high as the entrance of the ducts of the sebaceous glands. Externally is a thick layer of connective tissue arranged in longitudinal bundles, forming a more open texture and corresponding to the reticular part of the corium. In this are contained the blood vessels and nerves. The inner or epidermic coat is closely adherent to the root of the hair, and consists of 2 strata named respectively the outer and inner root sheaths. The former of these corresponds with the stratum mucosum of the epidermis, and resembles it in the rounded form and soft character of its cells. At the bottom of the hair follicle these cells become continuous with those of the root of the hair. The inner root sheath consists of 1. A delicate cuticle next the hair, composed of a single layer of imbricated scales with atrophied nuclei. 2. 1 or 2 layers of horny, flattened, nucleated cells, known as Huxley's layer. And 3. A single layer of cubical cells with clear flattened nuclei, called Henle's layer. The hair bulb is molded over the papilla and composed of polyhedral epithelial cells, which as they pass upward into the root of the hair become elongated and spindle-shaped, except some in the center which remain polyhedral. Some of these latter cells contain pigment granules which give rise to the color of the hair. It occasionally happens that these pigment granules completely fill the cells in the center of the bulb. This gives rise to the dark tract of pigment often found, of greater or less length, in the axis of the hair. The shaft of the hair, scapus pili, consists, from within outward, of 3 parts, the medulla, the cortex, and the cuticle. The medulla is usually wanting in the fine hairs covering the surface of the body, and commonly in those of the head. It is more opaque and deeper colored than the cortex when viewed by transmitted light, but when viewed by reflected light it is white. It is composed of rows of polyhedral cells containing granules of elidin and frequently air spaces. The cortex constitutes the chief part of the shaft. Its cells are elongated and united to form flattened fusiform fibers, which contain pigment granules in dark hair and air in white hair. The cuticle consists of a single layer of flat scales which overlap one another from below upward. Connected with the hair follicles are minute bundles of involuntary muscular fibers, termed the arrectores pilorum. They arise from the superficial layer of the corium, and are inserted into the hair follicle below the entrance of the duct of the sebaceous gland. They are placed on the side toward which the hair slopes, and by their action diminish the obliquity of the follicle and elevate the hair. The sebaceous gland is situated in the angle which the arrector muscle forms with the superficial portion of the hair follicle, and contraction of the muscle thus tends to squeeze the sebaceous secretion out from the duct of the gland. The sebaceous glands, glandulae sebaceae, are small, sacculated, glandular organs, lodged in the substance of the corium. They are found in most parts of the skin, but are especially abundant in the scalp and face. They are also very numerous around the apertures of the anus, nose, mouth, and external ear, but are wanting in the palms of the hands and soles of the feet. Each gland consists of a single duct, more or less capacious, which emerges from a cluster of oval or flask-shaped alveoli, which vary from 2 to 5 in number, but in some instances there may be as many as 20. Each alveolus is composed of a transparent basement membrane enclosing a number of epithelial cells. The outer or marginal cells are small and polyhedral and are continuous with the cells lining the duct. The remainder of the alveolus is filled with larger cells containing fat, except in the center where the cells have become broken up, leaving a cavity filled with their debris and a mass of fatty matter, which constitutes the sebum cutaneum. The ducts open most frequently into the hair follicles, but occasionally upon the general surface, as in the labia minora and the free margin of the lips. On the nose and face the glands are of large size, distinctly lobulated, and often become much enlarged from the accumulation of pent-up secretion. The tarsal glands of the eyelids are elongated sebaceous glands with numerous lateral diverticula. The sudoriferous or sweat glands (glandulae sudoriferae) are found in almost every part of the skin, and are situated in small pits on the under surface of the corium, or, more frequently, in the subcutaneous areolar tissue, surrounded by a quantity of adipose tissue. Each consists of a single tube, the deep part of which is rolled into an oval or spherical ball, named the body of the gland, while the superficial part, or duct, traverses the corium and cuticle and opens on the surface of the skin by a funnel-shaped aperture. In the superficial layers of the corium the duct is straight, but in the deeper layers it is convoluted or even twisted. Where the epidermis is thick, as in the palms of the hands and soles of the feet, the part of the duct which passes through it is spirally coiled. The size of the glands varies. They are especially large in those regions where the amount of perspiration is great, as in the axillæ, where they form a thin, mammillated layer of a reddish color, which corresponds exactly to the situation of the hair in this region. They are large also in the groin. Their number varies. They are very plentiful on the palms of the hands and on the soles of the feet, where the orifices of the ducts are exceedingly regular and open on the curved ridges. They are least numerous in the neck and back. On the palm there are about 370 per square centimeter, on the back of the hand about 200, forehead 175, breast, abdomen, and forearm 155, and on the leg and back from 60 to 80 per square centimeter. Krause estimates the total number at about 2,000,000. The average number of sweat glands per square centimeter of skin area in various races as shown by the fingers is as follows: American, white, 558.2; American, negro, 597.2; Filipino, 653.6; Moro, 684.4; Negrito, adult, 709.2; Hindu, 738.2; Negrito, youth, 950. They are absent in the deeper portion of the external auditory meatus, the prepuce, and the glans penis. The tube, both in the body of the gland and in the duct, consists of two layers, an outer, of fine areolar tissue, and an inner, of epithelium. The outer layer is thin and is continuous with the superficial stratum of the corium. In the body of the gland the epithelium consists of a single layer of cubical cells, between the deep ends of which and the basement membrane is a layer of longitudinally or obliquely arranged non-striped muscular fibers. The ducts are destitute of muscular fibers and are composed of a basement membrane lined by 2 or 3 layers of polyhedral cells. The lumen of the duct is coated by a thin cuticle. When the cuticle is carefully removed from the surface of the corium, the ducts may be drawn out in the form of short thread-like processes on its under surface. The ceruminous glands of the external acoustic meatus and the ciliary glands at the margin of the eyelids are modified sudoriferous glands. End of Section 63. End of Anatomy of the Human Body, Part 4, by Henry Gray.